A new report just released from NC State gives us our first look at how many students were struggling with their mental health even before the pandemic. Tonight we're walking you through the numbers and what the university says it'll do to help after 5 students at NC State died by suicide this school year. Thank you for joining us. I'm Gerald Owens.
And I'm Deborah Morgan. The report is about 80 pages long. One of the key numbers we found was from 2019, before the pandemic, when 12%, which is about 4,400 students, responded to the survey saying they had had suicidal thoughts. It also highlights a recent survey of college students across the country where a little more than 72.4% of students said the pandemic had an impact on their mental health.
WRAL's Joe Fisher is live at NC State with the new recommendations for how the university is going to confront this crisis. Joe.
Gerald, this new report puts it very plainly. The nation is in crisis, and NC State is no exception. This report lays out more than 50 recommendations for how to improve students' mental health, and it really calls on the university to build a stronger community that includes a greater sense of belonging for students.
I want people to know that so much effort went into this.
Eleanor Lott is a sophomore at NC State and one of 28 people on the mental health task force. Over the last 3 months, they've received more than 1,000 public comments after 5 student suicides.
A big thing was lack of community. They felt like NC State did not have the community specifically that it had pre-COVID, is what we heard a lot.
The report outlines long-term goals like adding a dean of students, a wellness app, more gathering spaces, suicide prevention training for faculty, relaxed attendance policies, more flexibility with assignments, and a peer mentoring program.
Students are more apt to talk to each other before they come and talk to any of us.
Monica Osborne is director of the Counseling Center, where some students have reported extensive wait times. Osborne says they've already added 8 new clinicians and prioritized people with emergency needs.
Any student who wants to access services, they will be seen that day if they want to be seen that day.
The report says some changes could happen by the end of the year, like mental health training for students, a campus-wide theme to promote wellness, and hiring even more counselors. This semester, NC State also launched a free telehealth counseling service.
If you are willing to do therapy online, I think it's a fantastic resource for anybody.
Professors are asking for changes to student advising, perhaps reducing the student-to-faculty ratio to help first-year students adjust and stay on track.
It's the small things that will really build community so that students can come together and say that they're proud to go to NC State.
And we've been covering this issue for months now. I can tell you, in talking with so many students here on campus, one thing they're really struggling with is time management, especially coming out of the pandemic with so many of their classes online. This report does recommend adding a class for first-year students that tackles topics like stress management, time management, adjusting to college life, and where exactly to find help for those students who need it. Gerald.
That first year always a leap when you go from high school to college. Joe Fisher live at NC State. Thank you, Joe. If you or someone you know is struggling, the National Suicide Hotline number is there on your screen. It is 988. We also have resources on WRAL.com. Just search Get Help.